Okay, we have the first blood vessel coming of the femoral, which is going further backward here. That is your lateral circumflex femoral artery. Then it continues further down. It gives off the proximal caudal femoral, and then the important blood vessel which comes off there is the saphenous artery. Along with the saphenous artery, we can see the medial saphenous vein, which continues further down, and then it splits into cranial branch of the medial saphenous and caudal branch of the medial saphenous. Along with that, we also see the saphenous nerve continuing further down. So right here we have the saphenous artery, that is your then as we come further down, the caudal femoral is also the femoral also going to give off a couple of more branches, like the middle caudal femoral and the distal caudal femoral, that we can see as we go further down. At this point, one of the important blood vessels that to notice here is the descending genicular branch. The descending genicular branch is branch of the femoral, which then continues towards the stifle joint, blood supply to the stifle. At the same time, you have the descending genicular vein draining into the femoral vein. Femoral vein then further continues. At this point, it is going to run obliquely, will now move more on the lateral side, so we can now follow the femoral artery and corresponding veins on the lateral side. Before we go to the lateral side, so we have the femoral continuing further down, we have the cranial caudal femoral. After this, the major blood vessel here is the saphenous artery. Saphenous continuing further down, it will give off the caudal branch of the saphenous and the cranial branch of the saphenous. Cranial branch of the saphenous, which is seen right here, not fairly well injected in this specimen, but it should go more on the dorsal aspect and takes care of the blood supply on the dorsal aspect of the pes. While the caudal branch of the saphenous, which then continues further along with the tibial nerve, which can also be seen here between the common calcaneal tendon and the deep digital flexor muscles, which would further continue on the plantar surface of the pes. Okay, so medial saphenous vein, saphenous artery with cranial and caudal branches of the saphenous, and we have cranial and caudal branches of the medial saphenous vein. Along with that, we also see the saphenous nerve. Remember, your saphenous nerve is more cutaneous in nature, as it takes care of the cutaneous innervation on the medial aspect. Okay, let's turn it to the lateral side now, and we'll look at some of the nerves and some of the blood vessels on the lateral aspect. Now, as we said earlier, that the femoral artery, it runs obliquely and then it continues further more on the lateral aspect of the hind limb. As soon as it comes slightly caudal to the stifle, it gives off a large branch, which is your distal caudal femoral. Now, one of the important reasons for knowing this branch, as this is the last branch of the femoral. After this, femoral is going to become popliteal artery. The popliteal artery then continues further down . Now, as we have tibia and fibula located here, it will run through the interosseous space between the tibia and fibula, which would appear on the dorsal aspect of the cross of the hind limb, which can be seen by transecting muscles like long digital extensor as well as your fibularis longus or peroneus longus. The blood vessel that we see here is the cranial tibial. Okay. The large blood vessel that is seen here, that is the cranial tibial artery, and cranial tibial will also give off one more cranial division of that would come a little bit superficial, while the one which is located deeper is further continuation of the cranial tibial artery. Along with the cranial tibial artery, you also see the cranial tibial vein. The cranial tibial artery as well as the cranial tibial vein, as we see them further coming down, as it continues over or as it continues distally and on the dorsal aspect of the tarsus, it will be called dorsal pedal artery. And so the dorsal pedal would continue further down. At this point, it would be called dorsal pedal, and dorsal pedal then would continue further down here as a dorsal common digital artery for the dorsal aspect of the pes, as well as it will give up perforating branches which would also contribute to the plantar aspect of the pes. So we followed the femoral artery and some of its branches from the proximal to the distal part of the limb. The other branch of the popliteal is the caudal tibial, which usually ends in the muscles on the caudal aspect of the crus, so that need not to be followed all the way down, because the blood vessel is going to end into the flexor muscles of the flexor muscles of the digit and extensor muscles of the tarsus. Okay, so let's review those blood vessels on this side. So we see the caudal femoral, the distal caudal femoral artery. Then along with that we have the same vein. Here we see on the lateral aspect the lateral saphenous vein, the cranial division and the caudal division. The cranial division is the one that you often use for intravenous injections, which then continues further down here on the dorsal aspect of the tarsus. It is going to anastomose with cranial division of the medial saphenous vein, and here these are the anastomotic branches. Then those are dorsal common digital veins and the plantar common digital veins that can be seen. So here we see the plantar common digital vein joining the lateral saphenous vein. The lateral saphenous vein and medial saphenous vein, they are anastomosing on the dorsal aspect of the tarsus, and here we have the superficial veins on the pes. Okay, so that is your lateral saphenous vein, which then continues further caudal femoral and then enters into the femoral vein.